Okay, so here we are on session 3 of Cup of Care, and I'm with my lovely friend. Have I said your name before? Am I allowed to say your name?
I think you are. I think so. I think everybody's got a name.
I think it'd be a bit rude not to say your name, really, wouldn't it?
Give me a new name if you want. I'll go by that.
No, this is Janet, obviously, and I'm Nikki from Nurses.co.uk. And today's session we had planned was going to always be about COVID, because here we are on March the 24th. And obviously 2 years ago, yesterday actually, we went into lockdown. And one of the reasons that I remember that particularly well was because it was also the day that we moved house. Don't do any things by halves. That was 2 years ago. But one thing that I'm really fascinated to learn today about you, Janet, is that you took the decision to become a nurse because of COVID. So I'm going to pass it over to you just to talk about that straight away, because I think that's quite incredible, really.
Well,
So
2 years ago to yesterday for me, I was sat watching the television at it would have been going on for 6 o'clock, I think, and I think it was a Friday, wasn't it? And at that time, I owned a little cafe in a seaside town, and I had about 11 staff, and we'd had a very quiet week because nobody was coming out anymore. Boris Johnson had already told people to stay at home. He hadn't locked anything down, but he had strongly advised people to stay at home. So we did virtually no trading that last week at all, just wondering what's going to happen next. We didn't know anybody that had the virus at that time, but we were watching the television and it was in Italy, and obviously it was massive in China. And so that Friday night, when we'd shut the shop, I'd come home and put the television on, knowing that Boris Johnson was going to say something. That was it. He just shut my shop along with everybody else's shop, and it was a kind of a goosebump moment, really, because nobody had ever been through anything like that in my lifetime. There were never announcements on the television of such magnitude as was happening at that time. It really did feel like something really, really massive that nobody saw coming, just completely out of the blue, and just totally against everything the way we've lived all of our lives.
absolutely.
So it really did blow my mind quite a bit that day. But of course, at the time, your head's just full of, what do I need to do? And what I needed to do was go and empty all the milk out of the fridge in the shop.
Because it would have been stinking otherwise if you'd left it and walked away.
I had like 20 odd pints of milk in the fridge because we were a coffee shop. So mainly what we sold was lattes, cappuccinos. So I had all this food to get rid of. So I spent the next day, the Saturday, doing that, shutting the shop up, making it so that I could walk away from it, because I didn't even live in the same town as my shop. So I knew that when I went home, I wouldn't be allowed to go back because of the lockdown. So it was like packing up. It was a bit like your move. It was a bit kind of, this is going to be the end of the story. It was the start of the story for you when you moved, but very much that we need to get everything into boxes and gone feeling. It's very strange indeed. And so I spent the next couple of months at home. I actually went and worked for Tesco, stocking shelves. Do you remember when there was that thing about the big supermarkets didn't have enough staff? And so they recruited like in a whirlwind activity. Literally, you put your name forward and someone rang you up and said, start work today, and you did. And I went and stacked shelves in a big supermarket, the one beginning with T, which I've already said, and worked there for 3 months. Wow. Just because I was in my business, everybody could be furloughed except for me, because I wasn't on the payroll. So my staff were all paid and were fine. but I wasn't, so I still needed to work.
My
So
goodness.
that's what I did. I went to Tesco. But while all of this was going on, and before I ever comprehended that my cafe would never survive, and it didn't, but even before then, that was the point where my mind started to turn back to nursing. And it's something that's happened right through my life at every kind of junction where I've got a decision to make about careers. Nursing has been there, and I've always gone in a different direction up until this time.
And
And
how many times had it been tapping on your shoulder? Had nursing been tapping on your shoulder up to that point?
probably a good at least 3 times that I can think.
Really?
Yeah,
Gosh,
yeah,
it
because
was so trying to get your
it
attention.
was, yeah, it was
And
nagging
why
away back,
why do you think up until that point you'd kind of like
pushed it
pushed it
away.
away?
Yeah, well, the first time it was the choice was when I was 18, and I just felt I was too young to do it at that stage. And
Hmm.
I didn't feel like a very mature 18-year-old. And I just worried about the level of responsibility and the weight on people's shoulders. And what if something goes wrong? And I can make the most momentous mistakes as it is without being a nurse. So just didn't have the confidence to do it at 18. But then a couple of other points along the way. I mean, I changed my career at one stage from being a careers advisor to being a dog groomer. And at that stage as well, it occurred to me that I could be doing nursing, but I chose not
I
to.
just so love your versatility. It's fantastic.
But
Absolutely
kind of
fantastic.
dog grooming's at least in the right direction, isn't it?
Absolutely, it is. Yeah, personal care and hygiene is really important, isn't it? So unbelievable. It's always about how good we look as well, because it makes us feel better. So yeah, there's absolutely crossovers, definitely. Wow. So tell me why then this time with COVID that you decided the time was right.
I think there was a small element of it's now or never, because I was 47 when I finally did fill in the form, and I'm thinking, even at 47, 51 by the time I qualify, that's still a 20-year career ahead of me, you know.
Absolutely. Yeah.
And so that's a very worthwhile career, I think, but I needed to kind of do it then to be able to get those 20 years in. But also, I just had to admit to myself, look, if I haven't got the experience now, I'm never going to have it, So
Yeah, definitely. And one of the biggest words of the pandemic was most definitely the word uncertainty.
mm,
And for you, did you not even have any concerns that you were stepping into something really huge when you considered that healthcare, the face of healthcare, was potentially going to change? And I know at that time you didn't see that, because
no.
this is part of our conversation today that we're
Mm,
going to have. But
mm,
it still was a really brave choice to
mm.
make in a time of uncertainty. What was your driving force for that courage, do you think? What was inside you that made you think that
Yeah.
you needed to be a nurse?
Yeah, for me, it was just the overriding thing of it's like when people run towards disaster, isn't it? And for my faults, I think I'm one of those people that will run towards disaster, and that's kind of what I did. And I just felt like I'm needed. This is, of all the times that people will train to do this, this is the point where we're needed most. And it was almost kind of like a one in the eye for COVID. It's like, what can we do to really arm ourselves against things like this to prepare better next time? And it's like, right, I want to be part of that scene. I want to be part of the future to make it better, to make COVID go away. So I just felt like I was running towards the disaster, really, rather than I'd spent all my life running away from it, from nursing. But deep down, I know that what I've done in the past is always to, if there's something going on, I'm there. Like, I volunteer, and it's just the way people are, isn't it? There's millions of us, thank God, who all are just, we just want to do our bit, and I just wanted to do my bit.
Well, thank you. I'm going to take this opportunity to say thank you so much for that, because that's just incredible. There was an email came through from the NMC from Angela Sutcliffe this week, saying thank you to all healthcare professionals that had worked through COVID. But it takes a lot of courage to make that decision, and thank goodness you did. And it just shows the mettle of the woman that you are, that that you would run towards that disaster. And I totally understand it. I mean, I think we're in a very different situation again with Ukraine, but a lot of people feel the same kind of thing. It's that collaboration of many people working together to solve a solution and to go towards it rather than run away necessarily from it. So it's really that is incredible. So
while we're on the topic though, thank you too, because you did your bit as a nurse for many years as well.
Thank you. Yeah, no, it was certainly an experience, because at the time I actually had a team of health coaches, or clinical coaches as we became, that were supporting patients with chronic diseases from staying out of A&E basically, and unplanned admissions. So luckily the model that we worked within, it was telephone based, so it was easy at that time to take the team home. I mean, obviously not to my home, because there would be far too many people, but we were able to work from home. And then a little bit later on, I did go into a care home scenario as clinical lead. And sadly, we had, in quite a short period of time, 5 residents that lost their lives to COVID. So that was a totally different kind of ball game. And the care home industry suffered so badly and was really kind of scapegoated in many ways. And I'll come back to that actually, because what I'd quite like to do with you is kind of reflect on some of the things that happened and the changes that came out of that. But let me just go back with you to your training, and with COVID very much running through the agenda of things, how did that change how your learning was delivered to you as a student nurse?
Yeah, well, it completely changed it. For the first year, we did, instead of doing kind of a mix of theory and then placement, we did a big chunk of theory, which was entirely done at home. I didn't need to travel to my university at all. Everything was provided online, and I have to say the quality of the online resources was amazing. It was so good. And I felt like for me as a returning learner, it was so good to have all that information at my fingertips. I mean, you have to remember that the last time I did a degree, there was no internet.
Yeah.
There were no mobile phones,
Yeah.
So the idea of opening a book to do a nursing degree is completely bizarre to me now, because now I can everything that I need, any question I need to answer is in there, and that's just amazing to be able, to tap into that at any time of the day or night. But when we started, we literally spent 6 months online, with nothing but chat groups to get to know the students. Because of course there was no Freshers Week, there was none of that going on.
Of course, yeah.
Which for the first timers at university, for the younger people meet their life partners at university. They weren't going to have that kind of experience at that point in time, which was, for them, that was a challenge. It wasn't so much for me, because I'd already been through it once. I'm there for the studying. I'm not particularly there for the social side of things in the same way as I would have been if I was 21. So yeah, it was in a way that it was quite isolating as well, because
Mm.
you didn't know what other students were doing. Was I learning enough? Was I taking in enough? Was I spending enough hours studying on my own? And although it was brilliant being at home for lots of reasons, that it was a bit of a degree in a vacuum for those first few months. And then when we went into placement, it was a bit like being let out of jail. All of a sudden, I'm out of the house which I've been in for 6 months, and I'm on a ward. And I've never been on a ward before in my life, hardly even as a patient, never mind as a member of staff. So to go from one extreme to the other was quite a revelation, really.
Yeah, and how do you feel that the patients received you? Do you feel that there was a degree of caution, or were they just really happy that you were
Yeah.
there?
For the patients, because one of the big things about COVID was just how it emptied hospitals of anyone who didn't need to be there. So unfortunately, that included visitors who very much did need to be there, but that decision had to be made that they couldn't be there. So for a lot of patients, they became much more reliant on the interaction that they had with the staff. It totally changed the relationship between the patients and the staff on lots of levels. Being a student, we were the ones that actually had the time to spend with patients,
Wonderful.
which they loved. They absolutely adored having anybody to tell their stories to. And as a first year student, I wanted to hear all those stories. I saw my main goal of my first year was just to develop that patient relationship. Clinical skills, there's plenty of time to learn all of those things, but your foundation is your relationship with your patients.
Absolutely agree, 100%. It's always about connection with people.
Yeah.
So many people pay lip service to the holistic ideal, but
Mm.
it is about the whole person. And in order to care and to nurture and to be compassionate with a patient, you
Mm.
need their whole story. You
Yeah.
need, their backstory,
Mm.
what's brought them here, their preferences, their dislikes, all those things all add up to being able to deliver the very best outcome for that person.
Yeah.
So yeah, one of the biggest takeaways from COVID, I guess for both of us and for all our colleagues out there, uh, was kind of two things really. One to do with health and safety with regard to PPE,
Mm.
and how important that had become,
Yeah.
just the process of hand washing, for example.
Yeah.
We'd always known it was important, but now we knew why.
Yeah.
um,
Yeah.
but
Yeah.
also, I think you've already touched on it in a really big way, but the whole communication part of
Mm.
being gowned up and
Yeah.
having a mask on
Yeah.
for people that, as we both know, when you're poorly and you're not 100%
Mm.
yourself, you
Yeah.
need all your faculties about you all the time just to be able to interact with somebody.
Mm.
And if that's slightly removed because you've got a mask
Mm.
and maybe another mask
Mm.
and
Yeah.
then great big hands and
Yeah.
gowns and God knows what, how did you cope with the PPE situation?
Yeah, it was a challenge. Again, from no caring background to having never worn anything like that in any of my working situations, that it was a really big challenge. The whole thing of how do you form a relationship with someone when you've only got your eyes, because the masks make it very difficult to talk and to be understood as well. And when people when they're reaching out to you for even more at that time, and what you can give them is actually even less, then it was really
Really
challenging.
challenging, yeah.
The heat as well
Oh,
in
gosh,
summer,
I
when
remember.
you're wearing plastic, and and it's a hot day, and like you say, that sometimes you've got a mask on, but then you've got a visor over the mask as well.
And
It
then sometimes glasses as well. I mean, it was
Yeah,
just
yeah, yeah.
how that was
Just
managed.
kind of felt like that in every way you were being challenged to be able to make these links with people. You were being, really pushed back into yourself, really. But the requirement was that patients needed you even more than ever. So the whole thing, the first couple of my first day on a ward, I had never felt so much like a fish out of water. In all my 47 years, I really did feel, I never once doubted what I was doing, being there, but I just had that feeling of being completely in a situation that I'd never dealt with before. And it only lasted for a day, but it just did really make you realise just what a tough thing to do it is. And for the nurses, even for the nurses that did it every single day, they experienced so many changes to the way they were working that they probably felt a bit like that. And I know some nurses had to change roles, and they probably felt like they were doing something that they'd never had to do before as well.
Yeah, a lot of nurses were redeployed into very new and different kind of practices that they hadn't been used to.
Yeah.
So, yeah, absolutely immense. And I think that leads very nicely into the other piece of COVID that changed dramatically, and that's technology. Not only from what you've said already about the online studying, but also as a means of communication for your patients, being able to, you being the link
Yeah.
between the outside world and their phone or iPad, and
Yeah.
trying to speak to family. I mean,
Yeah.
for everybody, that must have just been heartbreaking, but at the same time, the only option.
Mm.
So that was incredible
Yeah.
too.
Well, just my first big placement was in a spinal ward. And imagine you don't have the use of your arms and your legs, and the only way you've got of communicating with your family is a mobile phone. So how is that going to be managed? And the only way it was managed was that I had to hold people's mobile for them, and other members of staff did that, because what else were we going to do? But it's when you bring it down to that sort of level that you realise just how tough it is, when you've got people stood on the other side of windows, speaking to their relatives, because that's the only way that you can possibly see somebody's face, but they can't possibly be allowed in the room. But yeah, just that whole thing of we've got all this technology, but sometimes even the technology doesn't make it that easy.
Gosh, yeah. So with that as well, I just kind of wanted to add, I literally this week revalidated my my nursing through the NMC.
Congratulations.
Thank you. A body of work that is, my goodness me. And one of the pieces, the reflective pieces, was around COVID, because I did actually run a webinar for some of our nurses at an agency where I was the lead nurse, and just wanted to do an educational piece and a reflective piece on what COVID had meant to them. And one of the things, because we at that time, the agency, and still does actually, supports nursing and healthcare assistants in the care home industry, and that was really, again, another very tough situation for elderly people, particularly those living with dementia. Two things: first of all, to be confined to their rooms
Yeah.
because of the spread.
Yeah.
And those living with dementia not understanding that at all.
Yeah.
And then secondly, not having the family there to support them, and not being able to understand as to what had happened or why that was. And it was actually heartbreaking, because you saw cognitive and nutritional decline, because obviously eating is one of those amazing shared experiences that everybody can partake in, as well as family members from outside. And yeah, that was a really big a big thing that happened. We had to address a lot of weight loss through the MUSK scores, etc., because people just weren't they were struggling with eating as it was. A lot of elderly people have a reduced appetite, as you know, but
Yeah.
this was a big problem. It was a really, really big problem, which
Mm.
we eventually kind of got around by working collaboratively with multidisciplinary teams and fortifying foods and using supplementation and just trying to engage with people at their level in their rooms as much as possible. But they were really big concerns. So that was one of the takeaway pieces that I reflected on, because it really changed a lot of things. So going back to that, here you are in your second year, and you've got the future of healthcare ahead of you. In your mind, what are the main things that you feel have shifted in healthcare in a positive way? What have we learned from COVID that we can use going forward, in your opinion, Janet?
Well, I mean, I wonder whether any patients are ever going to see my face. First of all, am I ever going to be in a ward where I don't have to wear a
Well,
mask?
let's face it. If they don't see your face, then there's going to be a travesty, because you've got a lovely, lovely, caring, gorgeous face. So they need to
Oh,
see
thank
your
you.
face.
That's why I said it. but yeah, the things that have, I think probably the mindset has changed more than anything else. I always think there's a thing about, if you give someone 5 hours to do a task, they will take 5 hours to do a task. If you give them 3 hours to do the same task, they will find a way to do it in the 3 hours. And we were in that situation a lot, weren't we, where we were doing the same tasks but in a different way. Either it had to be done quicker or with fewer people, or the list of steps had to be rejigged so that it worked better. We talk about it a lot in nursing, don't we, about resilience and resourcefulness, and we did just see such a lot of that. I think also, though, another one of the big changes is around compassion, and what patients go through in terms of the burden that the visitors would normally bear would be to support their relatives through the dark times of whatever their experience was. And because the relatives weren't there, the nurses and the healthcare staff had to be that support. And I think that will continue. I think that will overhang. That some of the staff will realise that just is going to be a part of their job, even though visitors are back now. I think a lot of people did actually enjoy that level of one-to-one interaction, because we had kind of allowed visitors to take that and to be in charge of that, while we ran around doing a million other things.
Yeah.
But when there was only us to do all of it, then I think we realised that actually that was a part of nursing that we always wanted, we always enjoyed. That's why a lot of people are nurses.
That's exactly what you said at the beginning, that you really enjoyed that sitting down and finding out about somebody, why they were there and what happened to them. It's such an important part of the assessment to discover someone's needs, if nothing else, just for their care plan. But I agree with you, and I've always felt that that's a very attractive part of nursing. That connection with people, where you could psychologically and emotionally support them as well. It's not just a physical thing. No, I agree. And I also think the future possibly looks a little bit more like hospitals without walls. And what I mean by that is that technology has advanced big time. I mean, all of us, whilst we were in lockdown, utilized technology. I mean, look at us right now.
Exactly.
5 years ago, we'd have been trying to work out where we would meet to do this. You know what I mean? So, and the kind of I suppose the telehealth piece in itself is huge. It gives us the possibility for diagnosis and treatment of people without actually having to leave your home, where you could get a whole team, so that you, in effect, you potentially collapse the timeline,
Yeah.
which is a positive thing.
Yeah.
But of course, there's also negative things too, and we've touched on that already, because it's also so important to have that connection with people. So while technology is fantastic for that, the connection is potentially lost. And that is a little bit of a worry, because I've heard quite a few people say that they're not happy with the ability not to get an appointment with their GP to sit face to face. And 9 times out of 10, that's because when people go to see their GP, the ailment that they go to speak to them about is actually not the thing that's the problem. There's something underlying, and both the GP and that person sitting there both have the capacity to be able to open that channel to find out what that is. And you cannot do that over the phone necessarily. Well, you can if you're really good, but you know what I'm saying, that. So there's swings and roundabouts, isn't there?
It's the trust and the reassurance, isn't it, that you get from that face-to-face contact sometimes. Well, the thing that you're really bothered about, that you've blown up out of all proportion in your own mind, you need someone with a medical background to be able to tell you exactly what that is. And part of that is that reassurance does come from personal contact a lot of the time.
Definitely. So the other reason that it was important to have our call today, because I think you originally were planned for next week, the end of the month, but you're off on your hollybobs, aren't you? Which is nice.
I am on my jollies, yes.
Lovely and well deserved, and I bet you're really looking forward to it. But I wanted to see if we could potentially nail it, which is looking like we have, which is good, because I actually have COVID myself this week. I know you know this already.
Oh, bitch.
No, it's fine. But it's one of those really strange things, managed to dodge it for 2 years, literally, until last Friday stroke Saturday. Tested again today, unfortunately still positive, a lot better than I have been earlier in the week. Definitely had high temperature and an ongoing headache and all kinds of bits and pieces. So it's a bit of a beast. It is a beast. But luckily I'm also skilled in lots of kind of physical intelligence work, so I'm doing a lot of paced breathing and lots of self-healing and taking that time, and it does interest me extensively how if there was a positive thing from COVID, and please, that's not taking away the hundreds of thousands of people who have lost their lives, which is absolutely awful. But if there was a positive thing to take away, it gives us the opportunity to slow and repace and restore and heal. And there's not many other opportunities that you can get when you have a really bad virus that stops you in your tracks. I mean, for me personally, I have had all 3 of my vaccines, and to be honest, I had them very early on, so I would imagine they've waned, and that's possibly why my husband's got it too. He's also has been quite bad, but we're in our mid-late 50s, and so we're generally really quite healthy and lucky. But I do think it has given me the opportunity to think, okay, it's always about something getting your attention and how you react to it, and so far so good. But there's definitely challenges, and I know long COVID for lots of people is a concern going forward, but it is what it is, isn't it? And we've all just kind of shifted and adapted to our circumstances. Remind me, have you had it?
No, I don't think I ever have. If I did, I was asymptomatic. But considering I haven't shielded at any point, I've always had a job right through the whole lot of lockdown and everything. And I've been in and out of the hospitals and everything. I've been in and out of care homes. and I've never tested positive once. I've still got testing kits, and my husband's had it, but I was here while he was there, so there was no chance of me catching it from him. So no, and it hasn't really been that close to my door, which is really strange. But who knows? I could easily be an asymptomatic sometime and never known about it. But I think what you were saying, it kind of does make the interesting point that we kind of at this point in 2020 as it was, we kind of reached that stage where as a species we kind of felt a bit like there was nothing to beat us, didn't we? And we in our working lives, very much the philosophy was, oh, if you've got a sniffle, you don't need to be off work for that. You really don't need to be off work unless it's something really, really serious. And if people did have time off work, we thought they were swinging the lead a bit, didn't we? And there was this, we were getting towards this whole mentality of, why are you not at work? And I think that in some ways it is a positive thing that COVID has made us realise that we're not invincible.
Absolutely, I agree.
And you can't work through things, and there shouldn't be an expectation that you will go to work when you're poorly. I mean, I know kind of we went from one extreme to the other with the isolation situation, but really, lots of businesses suffered as a result of isolation, but lots of businesses actually still managed to keep going even with isolation. And it just makes you think, well, when we were telling people to soldier on and to go into work, did we really have to be doing that?
Yeah.
And can we actually learn the lesson that it is a good thing to take time off when you're not feeling well? It is a good thing to call that the point where you're going to recharge your batteries before it gets worse. And just use this opportunity to really reset the health stakes, that our health is more important than anything else, really.
I absolutely agree, Janet. And I'm lucky. I have an amazing boss who's very supportive. But I mean, even today, I could absolutely tell you, I could not get in my car and drive.
Yeah.
I'm still so woolly and so slightly detached that it just, and I also would then have gone on public transport to get into the city. And there's no way in this world that I would do that. But like we've said, there's the facility to work from home. But I think more importantly, it's that understanding that your body and your mind and your soul needs lots and lots of self-care, self-love, and healing. And to treat the body as a precious item that needs nurturing through this. So but really interesting with COVID. And again, thank you for everything that you've done. And
I haven't done anything yet. I've got 20 years for that yet.
It's going to be, well, let's just hope that you can get to a point where you don't have to wear a mask. Wouldn't that be nice?
It would be nice. It really would. Yeah.
Do you see that happening?
I don't know. I think that it'll be the last thing that goes. I think lots of other things will change, but I'd really, it's hard to say. I think it's so easy for the authorities just to say there are benefits from that, but I just feel like you're just missing that last piece of the compassion puzzle, really, that just really makes nursing that interpersonal career. It's just a shame, really. But I could understand it if they didn't change it, but I hope they do.
And just before we finish today, what are your thoughts on all the people that have had their treatment and diagnosis, for that matter, kind of pushed down and having to wait for that? Is that a big concern for you?
It's massive, because those numbers are scary. And
over 6 million now, isn't it? That are waiting.
Yeah, that's not even the true figure, because there'll still be people who the knock-on effect from the last year or two, people who won't know for another year or two that they've got something that needs treating, that might have been picked up on in regular screening tests before. So I don't think I don't think we've even got a handle on those numbers yet. And you just think like that if your treatment is 3 years delayed, what does that do to the outcomes? Especially for the kind of work I want to do. Those are the people that I will be working with, and you do just think that in some ways it's you'll never know, is it? We'll never really know if treatment could have been started earlier, would that have made a difference? But there are just going to be I mean, I know members of my own family who have struggled massively because they haven't been able to access the normal services that they would, and their health is now compromised and may never get to the stage it should have been at. They may
Yeah,
never recover
absolutely.
properly.
I so hear you. It's a real concern. And then hopefully, just on the flip side of that, there will be maybe some positive takeaways for some people that have been empowered to look after their health in a much better way themselves, rather than giving that power away to doctors and nurses to do
Yeah.
that. So maybe it's helped some people change their lifestyles to the point where they've been able to manage chronic conditions a little bit better. I mean, it is obviously a very different situation on the cancer side of things. I know that's something that you're particularly passionate about for the
Yeah.
future.
Yeah.
But yeah, I mean, we're still both here. We're still
Yeah,
both
yeah.
doing it. So
And nursing numbers are up as a result of COVID too. Nurse training numbers are up, so maybe we can find ways to leverage. We can offset against the other, hopefully.
yeah, definitely, definitely. Fantastic. So next month we're into April. Yay, April. We're going to look at comfort zones. Do you
We
want to
are,
just very briefly give people a
yeah.
snippet of what we mean by that?
Yeah, so I'm kind of at the midpoint of my training by then, and I'm starting to feel like now that all the things that I knew and that I brought with me into this training and that have got me to this point has been great, but I've been in quite a nice comfort zone of things that I know and things that I understand. Whereas now I feel like when I'm looking at my university timetable and seeing things on the ward and things, that I'm now starting to move towards things that I don't understand and things that I've never heard of before. And that's interesting because it's making me feel just like I'm just on the boundary of where my comfort zone ends, and I'm about to take a step into something a bit more unknown. And that's a challenge, but
Yeah,
good
yeah.
challenge. It's
It
something
is.
that
It's scary. It's that goes back to that uncertainty again. But
yeah.
I'm really looking forward to that conversation because it's something that I can support you with big
Yeah.
time, and there is an excitement around it as well. Because it's a new area for you
Yeah.
it just takes a lot of curiosity and courage. But as you've already demonstrated so well, you have bagfuls of both of those things, so that's not going to be a problem at all. But so I think we're looking at the 29th of April for that one.
Yes, we are.
But in the meantime, thank you so much for today, and have a really lovely holiday
Thank
next
you.
week.
And I hope you feel better soon. How
Yeah,
awful for you. It's just not very nice, is it?
definitely getting there. But I know it seems a little bit crazy, but it just seems a bit ironic to me that we were having this discussion around COVID, and here I am.
You've got
Full of
it.
but yeah, it's all going to get better. And as I say, there's some good positive learnings to take out of it as well. So
Yeah.
anyway, thank you so much for all your time
Thank you.
today,
It's been a
and
pleasure, as
I will
always.
um,